poster topic is adult onset Still's disease. I am Sucharitha, Avanapu, postgraduate, Department of General Medicine, MIMS, Nellimala. Introduction to my topic. Adult onset Still's disease is an autoinflammatory disorder of unknown etiology with a prevalence of less than 1 per 1 lakh people. It can manifest in multiple forms like pyrexia of unknown origin, serositis, aseptic meningitis, myocarditis, hemophagocytic syndrome, and septic arthritis. Coming to my case report. Here is a 35-year-old female patient came with complaints of joint pains, body aches, intermittent high-grade fever for 15 days, and sore throat with dysphagia with 1 month history. And joint pains involved both large and small joints. Despite of the analgesics, there was no relief in the pain. She had other comorbid illness. She had no other comorbid illness. Vitals are temperature is 101 degree Fahrenheit, BP is 100 by 70 millimeter mercury, pulse rate is 1 or 2 per minute, respiratory rate is 17 per minute, which is normal. Vitals are normal. Except for the temperature, it is high. And locomotor examination showed tenderness over multiple joints like spine, shoulder, wrist, metacarpophalangeal joints, hip, knee, and ankles. Coming to the investigations, hemogram is 9 gram per deciliter. Total leukocyte count is elevated. It is 15,000 per cubic millimeter. And coming to DLC, there is neutrophilia 90%. And platelet count is normal 3 lakh. Urea, creatinine, sodium, potassium is normal. Total bilirubin is again elevated 1.7 milligram per deciliter. Aspartate transferase and alkaline transferase. AST is 174 elevated for 5 greater than 5 times. 174 per liter, and ALT is 192 per liter, and ALP is 210 units per liter, and serum albumin is 2.8 gram per deciliter. Serum globulin is 3.5 gram per deciliter. Blood and urine cultures were sterile. Test for dengue, chikungunya, Epstein-Barr virus, hepatitis A to E, malaria, brucella, HIV, syphilis were negative. MAN2 is negative. RA factor and ANA profile were also negative, but serum ferritin was elevated. It is 3,435 nanogram per deciliter, and CRP is 48 microgram per deciliter, which is elevated, and ESR is 50 mm, which is also elevated. Chest X-ray, ultrasound, abdomen, 2D echo were normal. My diagnosis is adult onset Still's disease, fulfilling the Yamaguchi criteria. The major criteria are arthralgia present for greater than 2 weeks, fever greater than 39 degrees centigrade, and is intermittent and is present for 1 week. There is presence of typical rash, and WBC should be present. There should be presence of typical rash and WBC greater than 10,000 cubic millimeter. Coming to the minor criteria: sore throat, lymphadenopathy, and/or splenomegaly, abnormal liver function test, negative rheumatoid factor, and ANA. Diagnostic combination. Diagnosis by 5 criteria should be done with at least 2 major criteria. And the infections, malignancy, rheumatic causes should be excluded. Treatment is done with injection dexamethasone 4 gram given for symptomatic relief. After a week, the patient is discharged with a dose of 0.5 mg per kg of oral prednisolone. Conclusion: because of highly variable symptoms and rarity of the disorder, one should have high clinical suspicion on early diagnosis of this type of inflammatory disease, and prompt treatment can avoid adverse outcome. These were